Expressing the first milk. Most mothers of small babies will need to express milk until the babies are able to feed exclusively from the breast. She should start expressing within an hour of giving birth to establish a good supply of milk, including if she had a caesarean birth. This video will show how to teach a mother to express colostrum. This first milk is the most important nutrition for her small baby in the early days of life. The mother should have clean hands to express her milk and a clean spoon or cup. To help her milk to flow, have the mother stimulate her breasts by gently massaging with light stroking or gentle circular motions around the whole breast. Seeing and hearing her baby also helps the milk flow. Now, show her where to position her fingers. Placing a small piece of tape where her thumb and first finger should go will help her fingers find the right place. 2 finger widths from the nipple on opposite sides of the breast. Show her how to hold her hand in a C position, then guide her where to place her hand and fingers on her breast. Her thumb is on one side, her first finger is directly opposite, with the nipple in the center. Her other fingers support her breast. Placing your hand over hers lets the mother feel the emotion and is a good way to teach her the technique of expressing. There are 3 steps: pressing back toward the chest wall, compressing the thumb and fingers together, and then releasing. Where a mother places her thumb and fingers and how she presses will make a difference in her success at expressing her milk, especially early on. A look inside the mother's breast will show why. With her thumb and first finger on opposite sides of the breast, she presses back against the lobules to stimulate the milk to release into the ducts. Then gently compresses her thumb and fingers together to move the milk into the ducts and releases. Again, she presses back into the denser breast tissue, compresses a little tighter as milk flows almost to the areola, and releases. She presses back, and with a little tighter compression, the first few drops begin to come. Pressing back, compressing the thumb and fingers together, and then releasing. Have her alternate breaths back and forth. It's easiest if she uses the right hand to express the right breast and the left hand to express the left. The other hand holds the spoon. The mother should not expect to see hardly any milk at first. She's just stimulating the milk to start to flow. As she repeats the steps, the colostrum starts to come. Have her move her fingers around the breast to clear all segments. This will help the breast to empty. Suggest she stroke her breast now and then to keep the milk flowing. She should express until the drops of milk stop flowing. A small baby's stomach barely fits a teaspoon. So, on the first day, all we expect a mother to express every few hours is about a teaspoon. Expressing is a learned skill and will improve with practice. Eventually, mothers find a way to remove milk that works best for them. Caution the mother not to slide or pull her fingers on the breast toward the nipple, as this can make her sore. She should also avoid pinching or pulling the nipple. Removing milk should not hurt. If her fingers are too close to the nipple, the milk may not flow for long. She will release more milk when the fingers compress the denser breast tissue. To establish a good supply of milk, a mother should express every 2 to 3 hours throughout the day and night. Removing as much milk as she can each time until her breasts feel soft will help to ensure she will have plenty of milk for her baby. Remember, a mother of a small baby should start to express her first milk within an hour of giving birth. Guide her to hold her hand in a C position with her thumb on one side, her first finger directly opposite, and her other finger supporting her breast. There are 3 steps: pressing back toward the chest wall, compressing the thumb and fingers together, and then releasing.